I think the consequences of hypoglycemia can be divided into two, essentially. The first is that hypoglycemia can deprive the brain of an essential nutrient. So if the glucose falls below 50 milligrams per deciliter and progressively goes down, then the brain will stop functioning properly, patients will become confused, and clearly if they're engaged in activities which are potentially hazardous, driving an automobile is obviously the main one perhaps, then that can have consequences for them. They could crash their car, and of course they could crash into other people. And they can become comatose and unconscious, confused, and I think patients on insulin are concerned about those every day of their life. Now, we've known about that for a long time, but more recently it's become apparent that the hypoglycemia may have effects on other parts of the body, and the area of intense interest at the moment is the heart. And so we now know that hypoglycemia can produce changes within the cardiovascular system. It can increase the risk of thrombosis, it can set up inflammation, it can cause abnormal cardiac repolarization, and hypoglycemia itself, when it stimulates the sympathetic nervous system, will lead to increased myocardial oxygen demand, which could aggravate people with ischemic heart disease and lead to angina or even myocardial infarction. So there are a number of potential consequences. To be frank, we don't know which of those mechanisms are operating, but there does seem to be this association between a hypoglycemic episode and a risk of cardiac mortality in the following weeks and months.